This point is where we're going to call on the host of this beautiful event. We should call on our dear MD, person of Dr. Omo Ekeneam, for his welcome speech. You have the floor, sir.
The chairman of today's occasion, from Omo Ekeneam, the president and founder, WASPEN, Dr. Teresa Sichi, our speaker, you are recognized. Before I rest on the already established protocol, I want to also recognize my top management committee members, the head of clinical, Dr. James Ikwaku, and director of admin, Mr. Omo Patrick. And then finally, two other very, very important women. They're important to me, maybe not to you others. They were missed out during the introduction. One is Obi Wine Ajifo. She's a very senior palace chief. She's an Obi. She and her husband are Obi, and she's also a nurse based in the US. I don't know if she's retired, but I know she's in the US. And then the second lady that is very important to me is the wife of my dear pa, Mrs. Beatrice Elwaka. She's a nutritionist, retired from the Federal Ministry of Health in Abuja. So, ladies and gentlemen, you are all welcome. Good morning to all of us, and welcome to Asaba, the land of peace and hospitality. On behalf of our board chairman, who is unavoidably absent, management and staff of Federal Medical Center Asaba, I am deeply honored to welcome you all to this historic opening ceremony of the West African Society of Parenteral and Enteral Nutrition Conference taking place here in Asaba. As an institution that understands the importance of nutrition in care and treatment of our patients, we were happy when we were offered the hosting rights of the event. Nutrition is medicine. However, for a lot of clinicians, the focus is on drugs and surgery, thus underestimating the power of feeding the sick. A good number of patients are malnourished on admission, and this affects treatment outcomes. Wound healing is delayed, infection increases, length of stay doubles, and mortality rises. Here at FMT Asaba, we see it daily. The cancer patients who cannot eat, the stroke patients with dysphagia, the preterm baby in SCBU, the pulse patient losing protein, the ICU patients on ventilator. For them, parenteral and enteral nutrition is not an option, it is life-saving. I wish to commend WASPEN on the theme for the conference, Sustainable Clinical Nutrition Service, ensuring access, safety, and collaboration. As the medical director, I assure you of FMC Asaba's full support for this conference and for the WASPEN agenda. Our doors are open for research, for training, and for pilot projects. During the conference, we plan to inaugurate our own nutrition steering committee, which will be a multidisciplinary committee comprising of physicians, pharmacists, dietitians, and nurses. They will be saddled with the responsibility of advising management on issues that have to do with nutrition. In addition, we expect them to develop blueprints that will help to strengthen clinical nutrition in FMC Asaba and implementation of the lessons from this week's conference. All the members of the team are registered by the management of the hospital to be part of today's conference. I'm sure they are all staying there. Finally, I wish to appreciate the President of WASPEN, Dr. Teresa ECJ Pounds, for trusting in us to host a conference of this magnitude. Thank you, ma'am, for bringing West Africa's best minds in clinical nutrition to our doorstep. To our delegates from Ghana and all over the West African region and across Nigeria, Asaba welcomes you. I urge you to network, share your local experiences, and build collaboration that would outlive this conference. There is a saying in Asaba that Asaba Maka, which means Asaba is beautiful, and there are so many beautiful things, including historical sites in Asaba. Once again, welcome to Delta State, welcome to Asaba, welcome to FMC Asaba, and welcome to a new chapter in West African clinical nutrition. I wish you a fruitful celebration. Thank you and God bless.
Kili kana buku ose, yeah.